Hi everyone, this is our lecture on cystic fibrosis. So let's get started. Let's start off with a case. Let's say that an 8-month-old male infant is brought to a pediatrician for a wellness check. He was recently adopted with an unknown past medical or family history. The parents note that he has foul-smelling greasy stools and tastes salty when they kiss him. Our learning objectives for this lecture are to explain the genetics and pathophysiology of cystic fibrosis, to identify methods of diagnosing cystic fibrosis, to associate complications of cystic fibrosis with its pathophysiology, and to outline treatment of cystic fibrosis. Cystic fibrosis is an autosomal recessive genetic disease. It is due to a defect in the CFTR gene on chromosome 7. CFTR stands for Cystic Fibrosis Transmembrane Conductance Regulator. Now, there are different classifications of the mutation depending on exactly what's wrong with CFTR, but most commonly, there is a deletion of phenylalanine 508, which, as you can see in this image, stands for phenylalanine at position 508. Why do we need to learn about cystic fibrosis? Well, it's the most common lethal genetic disease in the Caucasian population. Well, who cares if CFTR isn't encoded? What does it do anyway? Well, CFTR encodes an ATP-gated chloride channel that secretes chloride in the lungs and the GI tract, as you can see in pink in this image, and reabsorbs chloride in sweat glands. The most common mutation leads to a misfolded protein, and so the protein gets retained in the rough endoplasmic reticulum and it's not transported to the cell membrane. As you can see in this image, how the pink CFTR channel is necessary for chloride secretion in the airway. So what happens? There's going to be decreased chloride and water secretion. On the right side of the image, you can see what happens when the pink channel isn't there. There's going to be an increase in intracellular chloride, which will result in a compensatory increase in sodium reabsorption via the epithelial sodium channels, or ENaC. Water follows sodium, so there's going to be increased water reabsorption. Why is that not good? Well, water helps to thin out our mucus in our airways, so we're going to have this abnormally thick mucus secreted into the lungs and the GI tract. In addition, increased sodium reabsorption causes a more negative transepithelial potential difference. Well then, how can we diagnose cystic fibrosis? It might be easier to look at what happens with our sweat, like in this image. An increased chloride concentration can be detected with a pilocarpine-induced sweat test, which is diagnostic for cystic fibrosis. Patients can present with contraction alkalosis and hypokalemia. Is there a certain drug class that you think of when you hear hypokalemia and alkalosis? Yep, you're right if you're thinking of loop diuretics. The extracellular fluid effects are analogous to a patient taking a loop diuretic. Remember, loop diuretics like furosemide inhibit the cotransport in the loop of Henle of sodium, potassium, and chloride. With cystic fibrosis, the extracellular fluid, water, and sodium losses occur through sweating with renal potassium and hydrogen ion wasting. Cystic fibrosis can also be diagnosed on newborn screening by the detection of an increased immunoreactive trypsinogen. Cystic fibrosis has a lot of systemic complications, which makes it very high yield for boards. Patients often have recurrent pulmonary infections, first with Staph aureus in their earlier years, followed by Pseudomonas aeruginosa in adulthood, as well as allergic bronchopulmonary aspergillosis. Now, very often, patients have chronic bronchitis and bronchiectasis, which, like in this chest radiograph, will show a reticular nodular pattern demonstrating extensive lung opacities, scarring, and mucoid impaction. An additional finding could be the opacification of sinuses. Furthermore, the electrolyte secretion and reabsorption dysfunction can lead to other complications, as we see in the image, including pancreatic insufficiency, malabsorption with steatorrhea, fat-soluble vitamin deficiencies, so vitamins A, D, E, and K, biliary cirrhosis, liver disease, meconium ileus in newborns, infertility in men, which could be with the absence of the vas deferens, whereas spermatogenesis may be completely unaffected, subfertility in women, which we would note with amenorrhea and abnormally thick cervical mucus, nasal polyps, and clubbing of nails. Keep a high alert out for cystic fibrosis if there is a newborn history of delayed passage of meconium, infertility, or symptoms of vitamin deficiencies. Again, cystic fibrosis is very multisystemic, but if you notice a predominance of sinopulmonary, gastrointestinal, and genitourinary symptoms like we've been discussing, cystic fibrosis should be high on your differentials. You can imagine that with multiple systems involved, treatment would be multifactorial, and it is. Again, there is abnormally thick mucus, and so chest physiotherapy, albuterol, aerosolized Dornase alpha, and hypertonic saline can facilitate mucus clearance. Additionally, azithromycin is used as an anti-inflammatory agent. Ibuprofen slows disease progression, and pancreatic enzyme replacement therapy can be used for pancreatic insufficiency. Because phenylalanine 508 is a recognized deletion, research has found that in patients with this deletion, a drug combination works pretty well. Lumacaftor can correct misfolded proteins and improve their transport to the cell surface, and ivacaftor opens those chloride channels to improve chloride transport. Okay, I know that was a lot of information, so let's do a quick flash quiz. Abnormally thick mucus is secreted into the lungs and GI tract because of increased or decreased reabsorption of sodium and water. Yup, there is increased reabsorption of sodium and water, so the mucus is abnormally thick. Well, let's revisit our case. Cystic fibrosis should be a high suspicion. If that's the case, then the infant tastes salty because chloride cannot be transported and reabsorbed in the sweat glands, and sodium stays behind too. The infant has foul-smelling and greasy stools, very likely due to pancreatic insufficiency. So what's the bottom line? Cystic fibrosis is an autosomal recessive defect in the CFTR gene, which is the most common lethal genetic disease in the Caucasian population. And due to defective transport of chloride, there's going to be multisystemic clinical findings that include recurrent pulmonary infections, pancreatic insufficiency, and infertility. Therapy is multifactorial. Well, that's all I have for you here. Please give this video a thumbs up if you liked it, and it'll give you the opportunity to submit a comment if you have any feedback or questions. Thanks for joining me. Study hard.